Well, good afternoon, everybody, and thank you for joining today's COVID-19 update in North Carolina. As of today, we've had 488,902 total cases, 5,255 new cases reported today, 3,001 people in our hospitals with COVID-19, and sadly, there are 6,291 people who have died. Our thoughts are with those who have lost loved ones, who are fighting this cruel virus, and we know their hearts are heavy during this holiday season. Today, an update to our county alert map reinforces what we already know. COVID-19 is spreading rapidly through our state. As of today, 65 counties are designated as red, which means critical community spread, and 27 counties are labeled orange, which means substantial community spread. This is alarming. 92 of our 100 counties are designated as red or orange. In the last week, we saw a daily case record of 8,444, with the percent of tests positive coming back at more than 10%. This virus continues to spread quickly. Don't get numb to these numbers. They have plateaued a bit over the last few weeks, but they are too high. We have strong safety protocols in place right now, and we have to keep following them. I want to thank local governments and law enforcement who are helping to enforce them. Our communities are safer for it, and your efforts will save lives. I also want to recognize those communities who have seen law enforcement officers shot and killed in the line of duty in these past several weeks. It is senseless and appalling. Violence can never be tolerated, including against law enforcement. And our hearts are with you and those families. Calls to those families are some of the hardest calls that I make, and my prayers are with them and those entire communities. So last week marked the first distribution of the Pfizer vaccine to 53 of our hospitals. This week, we'll continue distributing the Pfizer vaccine and begin distributing the Moderna vaccine as well, which is slated to go to 59 hospitals and 97 local health department sites. The federal government tells us how many doses to expect each week, and then the state decides where to send them. We expect about 60,000 doses of Pfizer vaccine this week and 176,000 of the Moderna vaccine. I've witnessed firsthand some of our frontline healthcare workers receiving the first doses of the vaccine. And Dr. Cohen and I were told yesterday at Duke Health that the most common side effect of the vaccine they are seeing is joy. Joy that is a good kind of contagious. I was so glad to see this because our frontline healthcare workers have had a tough time dealing with this painful, lonely, slow death and destruction caused by this virus. Until this vaccine gets enough people immunized, we owe it to those healthcare workers to double down on our prevention efforts like wearing a mask. When you think about their heroic efforts, spending all day on their feet in full protective gear, rushing from one ill COVID patient to the other, it doesn't feel so hard to simply wear a mask at the grocery store or when we are with people we don't live with. Come on, guys. We can do this. Finally, I want to warn about scams that we're seeing related to the vaccine. Don't fall for crooks calling or emailing you and offering a place on a vaccine waiting list. There is no such thing. They're either trying to steal your money, your identity, or both. The state has an action plan to distribute the vaccine effectively, and it does not involve calling you and asking for your personal information or your money. Now I'd like to recognize Dr. Mandy Cohen, our Secretary of Health and Human Services, for an update on where we are in North Carolina. Dr. Cohen.